Ghanaians get the much needed health care that they deserve. Thank you.
Congratulations once again. I know you would excel. I wish you the very best.
Thank you. Thank you, Mr. Chairman. Honorable nominee, congratulations on your nomination by His Excellency the President. Honorable nominee, I know your
Healthcare of Ghana to ask questions. So I'm going to yield the floor to honorable member who will be the last person on friends and basically subject matter areas. Then from there, we'll move on to the committee members to start asking questions. So you have the floor, please.
Thank you, Mr. Chairman, for the opportunity, and congratulations, Dr. Professor Grace Ayesu. When you look at the health sector, you have been in the private sector for some time, and you see how most of the private facilities are much more efficient sometimes when it comes to diagnostics and the rest. So the turnaround time in the diagnostics are faster in the private. But when you go to the public hospitals, patients generally complain about diagnostics that they will say, go and come tomorrow, come next tomorrow, go out and do this test and come back. I would want to know from you, what will you advise your minister to do to get these hospitals, public hospitals, equipped with the needed investigation equipments so that the turnaround time would be shorter for patients? Will you advocate for a PPP that would allow for procurement of equipment, placement, and maintenance contract, or you only would like the private sector to provide you money to buy the equipment? I want to know your opinion and how you advise your minister to make our hospitals, investigation, laboratories, imaging, and then the rest very efficient for patients.
Thank you, Mr. Chair. I believe that this matter has to do with health management or healthcare management. I have had the opportunity to manage a hospital in California called the Basto Community Hospital, and it has to do with management. It's not necessarily that the person is a doctor so they can manage a hospital. Health management or hospital management is a whole other field on its own. And I believe that in our public sector, what we don't have is that kind of proper health management. It's a business entity. So we need to get managers who are experts or competent in actually managing hospitals, so that they would know that, you know, when you buy an X-ray machine, for instance, what warranties do you get? Once the 2-year or 1-year warranty wears out, have you bought extended warranty? If you have bought extended warranty, what company did you buy it from? Does the company have in-country people to fix when there's a problem? So who is the one, if there's a problem, will calibrate your machines? Because remember, hospital equipments have to be calibrated. We also have an issue with biomedical engineering, as we don't have enough biomedical engineers in this country. So I know that it's part of the minister's plan to actually have, or in the NDC manifesto, about this biomedical engineering school that would happen, that would be done at the University of Ghana campus, so that we can train biomedical engineers to take care of this problem that you have. When you go to most hospitals, we have something called an equipment graveyard. And that's where all the bad things happen. Some X-ray machine is broken, then all the machines, we've pushed it to some corner. But sometimes you can take one small piece from this machine to fix another machine. So what we don't have is those extended warranties. The companies where we buy it from, do they have experts in country? If they don't, will they bring someone in country to help, or will they even bring someone from the company to train biomedical engineers in Ghana? So I think that once our biomedical school, which was in the NDC manifesto, is done, in the meantime, I have seen that the minister is also working on a lot of programs so that this particular problem that we are talking about will be a thing of the past. Once I'm given the nod, I will go to the ministry and I'll also support him with all my ideas, and then we'll see how best we can help fix that problem that you're discussing. Thank you.
Honorable nominee, I know we've given you the opportunity to demonstrate your competence, your knowledge and background, but please, let's keep the answers short. Just as I have asked honorable members who are asking you the questions to keep it short, please try and keep your answers short as well, so we can get this done before it gets late. Thank you. Next, we are now on the committee members to ask questions, and we'll go to Hajia Ladi to start us off. Thank you.
Thank you, Chairman. Congratulations, my sister.
Thank you.
For me, I want my answers, and I always demand very, very short. Reading your profile and where you are coming from, and what I know, and even heard part from you, the way you are able to work, I want to find out from you. What will you put in place to support women who get fistula after birth? I'm asking this because it's a very big problem, and you know it better. What will you do to support them?
Thank you, Mr. Chair. Female fistula, postpartum fistulas are a very big problem, and it has a lot of stigmatization for women. As we speak, I have already, maybe starting in 2012, I've been bringing doctors to do those procedures. So once I get to the ministry, I will work with my minister to see how best we can get more surgeons to come here to do free fistula repairs. The actual surgical procedure is not that big of a procedure, but it's very technical. So we need experts to come to support us. And once we're here, we can also train other doctors, local doctors, to be able to do those, so that the female fistula will be a thing of the past. Thank you.
My second question has to do with the same issue of fistula. You have just mentioned what you are able to do, bringing in people. But if you observe, you realize that most of the fistula cases do not actually come from those in the urban areas. Mostly it's from our villages, people who even do not have access to health at all, and they don't know what to do to themselves because they don't have the money. What will you do further, if given the nod, to ensure that those in our villages or rural areas, even if it were regional, also benefit from what you have just told us?
Thank you, Mr. Chair. Because of the technicality of that particular procedure, the patients that are going to undergo that procedure have to be brought actually to the urban centers. So what we can do is we can do good public announcements. Every city, every state, if you don't have a town crier, you have a public address system. So we can do maybe every 6 months a public announcement. People will come and we can bring them to the urban centers so that they can undergo that procedure. They need full anesthesia, and we can't do that in the field. Even if we did mobile services, we won't be able to do it. So we need to find a way of getting them. You know, when people have fistulas, it's easy to identify them in any community because of that stigmatization. So I believe that we can find ways of communicating to the rural areas to bring those people so that we can really work on them. Thank you.
Mr. Chairman, my third question. In the rural areas, although we encourage them to be delivered in the hospitals, but some of them are very far. And so they use the local women. They have a name, maybe you remind me, but I remember we have women who give the TBS, that is the traditional birth attendants, isn't it, who support them in the villages. But they have been so discouraged because there's no support for them. So some women actually struggle to give birth all by themselves. Some traditional birth attendants also take the risk and go to help those who are going to be delivered without even gloves. Will you suggest to your minister to take up this particular
activity to support the TBAs so that they can work better?
Thank you, Mr. Chair. I believe that issue you're discussing is access to healthcare and access to proper delivery. And I think all those things will be answered under the free primary healthcare program. Because at the level of a free primary healthcare, we can go into the communities and identify those women who are high risk of pregnancy or high risk at delivery. And once we identify them, we can take them up to the district hospitals so that they are removed out of the community and they don't end up with complications. And also, it will also help support the traditional birth attendant. Thank you.
Last but not the least, Mr. Chairman, the lowest level of getting medical attention from you, the professionals, mostly is at the CHIPS. For now, I know very well that most CHIPS compounds are not supposed to be built in just one community. They serve about, say, 4 or 5 communities. Some communities tend to be very far from the CHIPS. That notwithstanding, the CHIPS are just places like an aid, giving aid to patients and referring them. But you observe that some women, children, the elderly, persons with disability, they go there, and because they don't have it, they don't have the funds, they are not able, they don't even want to be referred. And sometimes when you refer them, they wouldn't go because they don't have the funds. In giving birth, I know we need beds, those beds that are used for women to give birth. We also need some few beds for the children, and then maybe for just the short-term admissions. But these items or this equipment is not readily available in our CHIPS. Will you use your office, and for that matter, in consultation with your minister, to use the philanthropic manner, humanitarian way that you have used in assisting, to ensure that some of our CHIPS compounds, if not all, because it can be a gradual process before we get everybody on board or all the CHIPS on board, can you help so that we begin something to support the rural folk?
Thank you, Mr. Chair. The issue of not enough CHIPS compound, again, this has to do with access. And President John Dramani Mahama has promised that, or my minister has, at least in the last press conference, was that we'll build 600 CHIPS compounds. So those 600 CHIPS compounds will be situated in places where the proximity to the CHIPS compounds will be shorter. And so they will be spaced out through the nation so that it has to do with proximity from the area, from home to the CHIPS compound. Lastly, some of the issue that you are discussing in terms of the facility itself, the services within a CHIPS compound, that will also be addressed under the free primary healthcare. Again, with the free primary healthcare, we want to make sure that when somebody gets to a CHIPS compound, they get all the preventative and promotive health they need. Unless the CHIPS compound is not able to do it, then they will transfer you to a higher level of care. Thank you.
Thank you very much. I wish you all the best and more grease to your elbows.
Thank you very much, Honorable. I would now like to give the floor to Honorable Patrick Boama. Honorable, please, you have the floor.
Thank you very much, Chairman, and congratulations, MP for Escado Ketain constituency, Professor Grace Ayensu Dankwa. I take you to page 4 of your CV. Chief Medical Officer, Director, Sage Medical Care 2021, present. Page 5. Cape Coast University Hospital, 2019 to present, School of Professional Health and Science Global College, Professor Surgery, 2019 present, 2018 University of Utah. Are you still in these employment? Have you appeared before the Committee on Members holding Office of Profit to sign up in accordance with Standing Orders 224 and Article 79 also of the Constitution?
Thank you, Mr. Chair. Almost all these places you have mentioned, I'm working pro bono. I don't get paid. I am still working at Sage Medical Center and I haven't received any remuneration. When I go to Cape Coast University Hospital, I don't get any remuneration. What I do, I'm a global surgeon and a humanitarian. So I go to these hospitals to support in teaching. Currently in Cape Coast Medical Center, we are doing a laparoscopy, which is a minimally invasive surgical training. In September, my team is coming from the US, and we are teaching the people there how to do surgery without big incisions and using the camera to get a 5mm and a 10mm incisions. So most of the work I do in Ghana or in hospitals are work that I do pro bono. I moved back to Ghana so that I can support the health system. And these are some of the things I do to support my country and the good people of Ghana. Thank you.
Very well. We'll be looking into that, whether you've been receiving some transportation allowances or it's possible, is it? Kobe.
Mr. Chair, I put 10% of my income down to do my humanitarian work. Thank you.
Well, Mr. Chair, then this takes me to my second question. On professional standards, ethics, medical negligence, and what have you, a lot of people have died in this country because of some level of negligence on the part of health professionals. From where you've trained, I've gone through your CV, New York to LA, Beverly Hills, and what, you've seen it all. What are some of the steps you'll be taking to assist your minister into improving the standards that you are so used to in the medical field in Ghana, especially now that you are going to be in serious public service?
Thank you, Mr. Chair. The issue with medical negligence is a huge issue, and I think that training, beginning of the medical training, is where we can teach and avoid those problems in the future in terms of when they become full doctors or full nurses. That is why I truly believe that that biomedical school that will be built in Legon or on Legon campus will actually be the solution to that problem. We need to teach them early in terms of the pre-medical teaching. For instance, in the US, the medical education, the first 2 years we do didactics where we are actually in the lab, we're in the anatomy lab, we're in biochemistry lab. So those are actual basic training. Before we get onto the field, we've had almost 2-3 years of just basic training. And that is what makes the expert a better expert. So I think that as we are revamping the curriculum, especially even in the nursing schools and some of the medical curriculum, once we get to where we are actually doing a better work with the pre-clinical training or the pre-medical training, I think that we will avoid some of these complications that you see. As I am right now, what I do now is really take care of other people's complications. So I know exactly what you're talking about, but it will start with proper training in the beginning. Thank you.
Chairman, thank you. If we leave the professor, she will give us a lecture here today. But my late dad started life in Sekendi, Takoradi area. And it's my second favorite city in the country. I'm always there. Kwesimintim, Sekendi, Takrade, Saima, those days. But you talk of Efiam Kwanta, and it's not like it used to be until the MPP decided to upgrade it. You're smiling. Yesterday, when the minister appeared before the House, it was part of the program that he was going to complete. He didn't admit that it was started and it had gotten to a point. So, today, it's okay. If you live in Tankofo or Kojo Krom, now telephone is available. But in the states where you used to live, they've advanced to the areas of telemedicine, which found expression in our manifesto. If you had not won the seat from us, and if we had won, it was part of our manifesto. But grace will not let us win. So it's okay. So telemedicine, I've gone through your manifesto. I didn't find it anywhere. Will you advocate for that? And don't say that it's because of the MPP. It was in the MPP's manifesto. If it's a good policy, it's a good policy. Would you support the introduction of telemedicine backed by law, so that those who live in the rural communities can have access to medical professionals, the doctors, rather than sitting in a car and getting to the hospital and the doctors will say, brought in dead. Dr. Anyansa Namukam, brought in dead. Professor, take your time.
Thank you, Mr. Chair. I think that, again, your question is going to access to healthcare, so that bringing the healthcare to the people is better than people coming up for healthcare. And that is why I believe in the President John Mahama's first term, he started with the mobile clinics, which is Onuado. Because once the mobile clinics get there, you can put the telemedicine inside the mobile clinic. Because remember, the telemedicine
President Mahama is the current president too. That's the second coming of JM. You are talking 2016. I said now. Now, Prof. Ciciara.
The second coming of JM will also continue with the Onuado. Again, it's about access to healthcare. We need to bring the health to the people rather than people coming to look for healthcare. That is what has caused all the backlog. And that is where some of the issues we are discussing. People just don't have enough access to healthcare. And the best way is to bring the health to them. That will be by mobile clinics, mobile hospitals, mobile surgical facilities. So once they get there, you can use those mobile clinics also as your source of telemedicine. Because once you are doing the telemedicine, at some point you still have to see the patient. At some point you still have to treat. So the telemedicine doesn't do everything. The woman in the village doesn't have access to high-speed internet. So it is those mobile clinics that will be equipped with the telemedicine, so that somebody can sit in Kojo Krom and look at an x-ray, and I can send an x-ray to the United States and somebody can read it for me. However, in the final analysis, I have to treat the person in Kojo Krom. I cannot treat them telepathically or on TV or on a screen. So regardless, there has to be some human contact. And that is why a mobile clinic is rather the solution than just telemedicine. Thank you.
Chairman, with a nominee who has politics as part of her hobbies, she will play politics around the table. It's okay. It's okay. Congratulations, Professor.
Thank you, Mr. Chair.
Thank you, Honorable. I'll now turn to Honorable Akulugu. You have the floor.
Thank you, Mr. Chair. Congratulations, my sister. Yes, we have shortage of health workers in the country. When you look at the statistics, those who are not able to afford medical care most of them go to the public hospitals. And when you go, in the morning, you see a long queue. Per ratio, one doctor, probably about 50 or sometimes 70. And then because of exhaustion from the doctor, he gets exhausted because of the number of people. Most of them are not able to be attended to. What are you going to do? Because on my desk right now, as we speak, we have a lot of doctors, nurses who have completed school and are seeking for employment. What are you going to bring to the ministry to help cap this menace? Thank you.
Thank you, Mr. Chair. I believe this matter is near and dear to the heart of the health minister. Since the last 6 months, about 15,000 nurses and midwives have been processed. He has processed about 10,000 doctors, and he's trying to process all the backlog of doctors and nurses that are home to bring them into the health system. And once that happens, the health disparities in terms of patient-doctor ratios will lessen. Even though we do have rural and urban disparities, I think that once we have absorbed all those who are home, some of these disparities will lessen. And then once we are there, we train more doctors and nurses, and then we absorb them. So efforts have been put in place to address those issues. And once I get to the ministry, I will support my minister to make sure that these efforts are expedited as you wanted. Thank you.
My second question. I hear you did not do science in Ghana. How true is that?
Thank you, Mr. Chair. Yes, in sixth form, I did history, English literature, and religion. When you go to the United States, you have an opportunity in your first degree to go any path you want, and I chose to do biochemistry and specifically biology for my first degree. Thank you.
Mr. Chair, no further questions. I'm wishing you all the best. I know you are capable of making us proud. Thank you.
Honorable Ma'am, you have just arrived, but you have the floor.
Thank you, Chairman. We have the women. Yes, Prof. We have the women. Thank you. Congratulations.
Go straight to your question.
Okay. Prof, I know Honorable Patrick Guama asked similar question. But my question has to do with medical malpractice. Would medical malpractice insurance reduce negligence in Ghana? Thank you.
Thank you, Mr. Chair. I think that, as you mentioned, Honorable Patrick had asked the same question. And to decrease the incidence or the prevalence of medical malpractice will have to be with better training or improved training. Now, once the malpractice happens, in places like in the United States, it's a very litigious society. So every doctor has to have a malpractice insurance. And the malpractice insurance actually is prohibitory. It makes some of us, we pay too much, so that the doctors are stressed under the malpractice. So I don't think that is the best practice. I think that once we've trained the doctors enough, and especially with the basic sciences and the basics of medicine, the malpractice cases would decrease. And also the doctors themselves or ourselves have to also do some peer evaluations and peer monitoring. That way we can anticipate the malpractice or the complication before it happens. And when it happens is how you treat the complications. It's not necessarily malpractice. We are able to anticipate it and fix it before it gets worse. Thank you.
Thank you, Prof. But don't you think that when somebody, if there is a punishment for failure to honor or to do something right, it will keep the doctors in check than giving them a blank check?
Thank you, Mr. Chair. Not necessarily. In the U.S., my malpractice insurance is higher than any money I have ever paid in my life, but it still doesn't prevent doctors from making mistakes or having malpractice cases. So I think that the solution, rather than punishing or putting a punitive problem or punitive way of fixing the problem, I think that would rather be proper training and also identifying the complication before it becomes a complication and how well you fix it. There's a saying that the sign of a good doctor is when you know there's a complication and how you can anticipate it and fix it. That's what makes a good doctor a good doctor. Thank you.
Very well. I have my second question has to do with ambulance system.
You are on your third question.
Okay, third question. The other one was a follow-up.
Well, you didn't say so.
Chairman.
Please go ahead.
Okay. Chairman says third question. My third question has to do with ambulance. As a rural MP, ambulance system or lack of ambulance is draining our pockets. And sometimes we have to use our party vans to cart patients to hospitals. In recent past, when even one ambulance, one constituency, most of the ambulances, about 70 to 90%, are sitting on blocks. And my question is, and they are not sitting on blocks because they are not proper, but because of the funding system. And so my question is, will you consider NHI absorbing ambulance and emergency system?
Thank you, Mr. Chair. I believe that emergency services are very important, and it's one of the I believe one of the systems that we haven't really gotten right. But I also know that my minister is really working on part of the free primary health care is retooling the ambulance service, getting more ambulance personnel, and then training them better, and also even bringing more ambulances on board. And I believe that once that is done, it will solve some of these problems with the ambulance service. I don't necessarily agree that the NHIS should also take over the ambulance service. Thank you.
Prof, the follow-up on the ambulance, I'm not talking about the number, but the funding system. Even if they give us Hampton numbers and we don't have a cost recovery for the ambulance system, it will continue to be so.
Thank you, Mr. Chair. I will liaise with my minister, my sector minister, and see what other plans they have for the ambulance service. But my opinion was what I had expressed in the beginning. Thank you.
I wish you well.
Thank you very much, Honorable. Honorable Jay, you now have the floor.
Thank you very much, Honorable Chair. Prof, I've just perused. First of all, I want to congratulate you on your nomination, and I'm hopeful that you're going to do very well. I'm not too sure if that is your special aide sitting, or he says your manager. Very well. Prof, please, I've perused your CV. Kindly look at page 9. And I'm very sure you drafted a CV, so just want to run you through a few things. Are you there? So under Community Health Department, please read what is there.
Sorry, Community Health Department. The National Service Personnel, Community Health Care assist 1-year national service work to promote healthcare in the rural areas of Ghana.
And I said under, so still under national service, 1986 to 1987, Accra, Ghana. national service personnel. Do you mean personnel or person? National service personnel or national service person?
I believe it's a typo. That's where I did my national service, right here in Job 600.
I don't know if you got my question. You said national service personnel. So my question is it national service person or national service personnel?
Thank you, Mr. Chair. I'm not sure what the difference is, but all it's trying to say is that I did my national service here in Job 600 at the National Service Secretariat, which was on the 9th floor in Job 600. Thank you.
Okay, so national service personnel. Chama, she said she doesn't know what the difference is. So I'm allowed. Or very well.
Honorable, national service personnel is what she was. That is my. This is English language, so we may differ. It's national service personnel is what she was, but if you want to ask another question or she wants to answer, she's allowed to do so.
Chairman, I was thinking that it should be national service person, but if you're thinking differently, I'm guided. Let me go on with my question. So my first question, do you have an idea how many teaching hospitals we have in Ghana?
I believe we have about 10 regional hospitals, and not all of them are teaching, but maybe somewhere around 6 to 10. Thank you.
I think my question was specific, so I've heard you talk about the new medical fund that is being considered. That's on the floor, which has been considered. You know the long title?
I think it's a trust fund, but I don't remember the full name because I popularly call it the Mahama case.
That is the more reason why I asked you that, because there is nothing like that. So I was hoping you give us the long title, which you should know. Prof, I wish you well. I have no further questions.
It is the Ghana Medical Trust Fund.
Honorable, thank you. Thank you very much. And I will now want to turn to, I'm not sure, Honorable Patricia PJ is, are you ready, Madam? Yes, please, you have the floor.
Thank you. Mr. Chairman, I would like to yield to the leader. Yes. I think, and take this opportunity.
You are yielding to is on his way out.
He's coming out. So I'd like to wish the honorable nominee very well. Thank you very much.
Very well. Then I will give the floor to the minority leader. Minority leader, you have the floor.
Honorable nominee, you are 6 months in Parliament after swearing in, correct?
That is correct.
What has been your very high moments on the floor of the House?
Thank you, Mr. Chair. My high moments of being in the floor has been the process in which bills are passed. I'm very interested and I find that intriguing. Thank you.
What are your very low moments on the floor?
Thank you, Mr. Chair. Currently, I don't have any low moments.
Have you had an occasion on the floor of the House where any member, particularly from the minority, has acted in a manner that you felt intimidated, disrespected?
Thank you, Mr. Chair. Currently, I don't recall. Thank you.
Honorable nominee, have you had an occasion on the floor in your short period in Parliament where an action by any member in the minority has caused you any discomfort?
Thank you, Mr. Chair. Like I said, I didn't recall. I don't recall.
Honorable nominee, have you had a cause to complain to your leadership in respect of any conduct against your person on the floor of the House?
Thank you, Mr. Chair. Not that I can recall.
Honorable member, your short stay in Parliament, have you had a cause to complain to either the Speaker or his deputies regarding the conduct of any member in the minority against your person that you feel so affected?
Thank you, Mr. Chair. Again, I believe you are asking the same question. I truly do not recall.
Honorable member, in your short stay in Parliament, have you come across any intimidating character whose character has had adverse effects on your person as a parliamentarian?
Thank you, Mr. Chair. I seriously do not recall.
You've been handed a document, a paper. I want us to do some verification exercise on that document. First, identify the document. It has your picture and your name. Is this from you? Is this a verified page, a social media page of yours, please?
Thank you, Mr. Chair. I cannot tell on a piece of paper whether it's a verified page or not. Thank you.
Honorable nominee, please read aloud the content of what you have before you.
Thank you, Mr. Chair.
From the name and everything that is there.
Again, thank you. Again, I do not believe, I can't tell from a piece of paper if it's a verified account.
Don't ask the question. I'm saying read. I've shared with you.
Professor Dr. Grace Ayensu Dankwa.
Yeah.
I extend my gratitude to the Speaker of Parliament for addressing the minority leader's unwarranted attack on me during the parliamentary session last week. Hashtag women at work. Hashtag the next Isikado Ketan.
Is this coming from you?
Again, Mr. Speaker, I cannot verify from a piece of paper. My Facebook account is Meta verified, and this does not have any Meta verification. Thank you.
My question is that whether you wrote this.
Again, Mr. Chair, I cannot verify a piece of paper. My Facebook account is Meta verified. There's no Meta verification on this page. Thank you.
Yes, Honorable Nominee, yes, I appreciate the fact that you've been sincere to say that this is not a verified page of yours. But I'm asking you, because you and I are involved in a perception-driven enterprise as politicians, and this bears your name. I'm asking you, since you don't recall and it's not verified, have you written a thing like this, please?
Thank you, Mr. Chair. Again, you're giving me a piece of paper that is not verified, and respectfully, as a lawyer, I believe you know about evidence. There is no evidence here that I wrote it. There are a lot of fake accounts in my name. Again, my Facebook account is Meta verified. This piece of paper has no Meta verification, so I cannot tell you whether this is my account or it's not my account. Thank you.
Honorable Nominee, that's fair enough. Man, a copy. Yes, give it. Okay, sure. Give it to him.
Okay, please.
My respected colleague, you gave us a 14-page CV. I claim your attention. You ready? You ready?
Wide-eyed and bushy-tailed.
You give us a 14-page CV. You sign against each page to confirm that this is coming from you. Clarify for me, when people address you doctor, people also address you professor, share with us which of these titles match your rank.
Thank you. Both do. I am a professor of surgery at the University of Utah in the United States. Thank you.
Now, there may be jurisdictional interpretations, so I would want you to have this opportunity to clarify for the general public to understand and appreciate where you're coming from. In Ghana, for instance, in the academia, someone may just have his PhD and lectures at the university, but will not be called a professor. You would have to do some publications, then you become an ASOProf, and then from there you become a full professor. Share with us the jurisdiction where you earn the title professor. How does it come by?
I have defended 2 theses. I have written so many publications, too numerous to count. And I have done a lot of research, too numerous to count. So if I may indulge you respectfully, where do you want me to start?
So, just very simply, have you been conferred with that title, which is a postdoctoral title, professor? Do you have a document from a certified body confirming same to you? Same that you've been conferred with that, just as is done in the Ghanaian jurisdiction, or is different from where you're coming from, please?
Thank you, Mr. Chair. The American system is completely different from the Ghana system. I am a professor of surgery. I have been teaching surgery for at least the last 15 years. Surgery is a skill. So we teach in the theater. We don't teach only in the classroom. As
Very
we
well.
are doing classroom work, we are also doing teaching in the theater. I am a full professor of surgery at the University of Utah and a professor of global surgery. Thank you.
So that's a very fair explanation. But I want to know from you. So how then does the person earn it? At what point do you then hold the title? Yes, you lecture. Yes, you do surgery. But at what point? Once you get in there, do you automatically carry the title, or it has to be conferred in one way or the other by rank? That's the clarification I want you to provide, please.
I am a professor of surgery at the University of Utah. I am a professor of global surgery by the American College of Surgeons and the American Board of Surgery. I have worked in teaching for the last 15 years. Thank you.
So the American College of Surgery, in its role, has your name there as Professor Ayensu Dankwa, correct?
American College of Surgeons has my name as a Professor Ayensu Dankwa. I am a board-certified surgeon, doubly boarded from the United States of America. Thank you.
Very well. Now, may I know from you, in an earlier answer when dealing with a question from one of our colleagues, you said that you practice in Ghana, correct?
That is correct.
Now, clarify this for me. In Ghana, I know that when people are qualified from other jurisdictions and they come, they are required to do something. I don't know whether it's examination or some interview, it's some process of accreditation. And they then get recognized and allowed to practice medicine in Ghana. Share with us your own experience.
Thank you, Mr. Chair. I am fully licensed in Ghana, not only as a surgeon, but also as a surgeon specialist. In 2014, I came to Ghana. Even though I was a professor of surgery in the United States, I came back to Ghana. I took a written exam for a whole day. The next day, I sat in front of 3 surgeons in Kuala Lumpur, and I did an oral exam. After the oral exam, I spent another full day doing an ethics class. My license in Ghana is license number MDCRN7629. It was conferred on me on 27 January 2014. That is just a generalist. And I also have my specialist license, both of which were conferred on me on 27 January 2014. Currently, my dues are all paid, and I'm a full member of the Ghana Medical and Dental Council. Thank you.
Correct. Now, in appearing before us, can you share with us whether you have paid your taxes or making arrangement to pay them?
Please, I have a GRA clearance, so my taxes have been paid. Thank you.
Which one? Honorable nominee, in Ghana, how many companies have you registered in your name? Or how many companies are you a director of?
I don't recall the exact amount, but most of them are charity organizations. I believe I'm a part of Healing Hands organization, which is a charity organization. I'm also a part of Esikadu Ketan Food Bank, which is also a charity organization that gives out free food, uncooked food to the poor and the needy. Healing Hands organization, we bring surgeons from outside the country to do free surgical care. We provide free medical equipment to people who need it, especially the disabled. And we also go to hospitals and we do teaching. Specifically for me, I teach people in rural areas how to do surgery. Basically the physician assistants as well as the doctors. I have been to several regions in the country to do my free work. I've been to the Volta region. I've been
Honorable
to Eastern
member.
region.
Honorable member.
I've been to Eastern region.
Bear with me. Hold on a
Do
second.
you want to hear my answer?
Please, hold on a second. You see, you remember Vice Chair on 2 occasions entreated you to be brief. The question was on companies. For me, once you answer that you are a director of a company limited by guarantee, we stay there. That was for 30 seconds so that we can make some progress. You get my point?
Loud and clear.
Very well. So that, because the Nananum behind you want to go, so we don't keep them here. Yeah? Now, you've said that companies limited by guarantees. What about limited liability company, profit-making establishment? Are you a director of any profit-making enterprise in Ghana?
I believe I'm a director of Sage Medical Center that is profit-making, but I personally don't get any remuneration from there. And then finally, I believe as of last month, one of my partners registered for the Gold Board, a company, but we haven't started business yet.
Forgive me, you have a different accent from, I'm trying to understand it. Repeat the last.
I said I believe that recently one of my partners registered a Gold Board company, but we haven't started any business yet.
Okay, so clarify, the Sage, let's stay a bit on Sage. You said you are a partner there, it's a profit-making company, correct?
Correct.
How long has it been in existence, please?
Maybe since 2021 or 2022.
And is that where you do the dialysis?
That is correct.
And is it your case that that company since 2021 has declared no profit?
Thank you, Mr. Chair. I don't know the company's finances because I'm personally not making any money out of there, not even 1 peso. The reason why we set up a dialysis company was that we found the need that Ghanaians needed dialysis. And that was a niche that I wanted to fill for Ghanaians. So I personally did it. I mean, I'm doing it as a charity work. I have never gotten any remuneration from the company. Thank you.
So, in other words, no taxes are paid on your behalf as a director. No director's fees, nothing.
No.
Very well. Now, Honorable nominee, please, I handed you a document. First of all, I relate to your background, and I will explain it this way. I was an art student going into BCom, and I was struggling, so I had to abandon it and go and do law, which was my passion. Would you say that getting into medicine getting into medicine was really your passion, considering your background in O level and A level?
Yes, it is truly my passion.
Now, the document that I've given you, look at page 2. If you look at page 2, paragraph 4, soon after your results, your Fijai records has it that you, in those days, you were inconsiderate and disrespectful. Would you say you have outlived this and been a greater person in accommodating?
Thank you, Mr. Chair. I beg to differ. In fact, I'm a very respectful, composed, intelligent woman. Thank you.
Very well. That's why I gave it to you. That it's not from me. It's the document from your own school, Fijai Secondary School. It's not me. So if you disagree with them, that is what they wrote.
Mr. Chair,
That's what they wrote to us.
For the record, I never went to Fijai Secondary
Sorry,
School.
Archbishop Porter Girls Secondary School at Fijai. That is what the document you have before you says. Archbishop Porter Girls, Fijai. It's not, that's why I give you a copy, so that we are fair. The essence of this is not to spring surprises, just to share with you.
Thank you, Mr. Chair. I beg to differ. In fact, in Archbishop Porter's, I was the entertainment prefect. I rose up to be a prefect in the school, and I don't believe that if somebody is disrespectful and inconsiderate, as you have put on the paper, would be rise to be a prefect in a school in Ghana.
Honorable nominee, in context, I am not the one producing the document. What you have with you, you know the source. So this is from authorized sources, not me. So I just want you to get that clarity. Now, let us go into the issue of your ministry. We on this, hold on.
Thank you very much. Leader, what you are talking from, the document you are talking from, is a confidential document. And respectfully, I don't have a problem lifting from it.
I did not press on certain things. When the letter to the National Intelligence Bureau, I am not the one who wrote it. It was written by the clerk on the instructions of the chair of the committee. And I reckon that we received as a confidential information. And it is the reason why I shared with you that take a copy and respond so that you will be able to put things in proper perspective. It is to help you. But if you pick it from the angle that it is the ranking minority leader who is asking you. No, this is coming from the states. So I wanted you to have an opportunity to respond. You've responded, so we can move on. Chairman, can we move on?
Let's make progress.
Yes, sure.
Let's make progress.
Honorable nominee, let me take you to your ministry. The aim at this point is to examine your preparedness to serve the Ghanaian people in this very critical role. Our health sector faces significant challenges, and your nomination comes amidst proposals for new health initiatives alongside the existing framework. Where you have evidence you can readily support with your answer. That said, I shall proceed. 1. In moments of public health crisis, expert input is often crucial, even when it challenges political considerations or directives. As a Deputy Minister for Health, how would you balance your role in providing expert technical guidance with the need to respect ministerial hierarchy, particularly when urgent decisions must be made that may conflict with prevailing political pressures?
Can you repeat the question?
Very well, I can. Thank you. So, you being an expert and finding yourself in a political space, I'm trying to find out from you how you can reconcile. So, with that background, I'll proceed to repeat the question. In moments of public health crisis, swift expert input is often crucial, even when it challenges political considerations or directives. As Deputy Minister Designate for Health, how would you balance your role in providing expert technical guidance with the need to respect ministerial hierarchy, particularly when urgent decisions must be made that may conflict with prevailing political pressures?
Thank you, Mr. Chair. As the Deputy Minister, I'm here to work with my minister in all endeavors or anything we undertake at the Health Ministry. And on that also, I would like to say that I have been in the professional environment for the last 20-something years. I have worked in the professional environment, and in the surgical field, it's mainly a male-dominated field. And as a woman, and as an African woman, I have worked very well with my male counterparts and in my professional life to be able to rise to the highest level of surgery in the United States. Thank you.
Thank you, Honorable Nominee. Honorable Nominee, from what you are saying, may I know from you what frameworks you will ensure by way of your clinical expertise to influence policy without creating institutional conflict with your minister?
Thank you, Mr. Chair. I'm here to in all the endeavors in the ministry and to make sure that his foresight and also the vision of President John Dramani Mahama is realized in the health field. Thank you.
Now, how would you advocate for evidence-based recommendations when facing political administrative resistance as an expert?
Again, I'm here to deputize my able Minister of Health to realize President John Dramani Mahama's vision to deputize my able Minister of Health to realize President John Dramani Mahama's vision for the health of Ghanaians.
Patterns.
Thank you, Mr. Chair. I believe that stroke is actually a complication of a chronic disease, more likely high blood pressure or hypercholesterol disease, more likely high blood pressure or hypercholesterolemia, which is high cholesterol. So again, President John Dramani Mahama's policy of a free primary health care, additional with the Ghana Medical Trust Fund, will be the solution to these problems. So once I get to the ministry, I will work with my minister to ensure that President John Dramani Mahama's vision of a free primary health care and also the Ghana Medical Trust Fund has been implemented. Thank you.
Now, perhaps you take this advantage to address the country as an expert. Within the constraints of our resources, how would you advocate for a prevention, emergency response, and rehabilitation on this very matter, which is killing a lot of our people?
Thank you, Mr. Chair. I believe that the solution to fixing the stroke problem or the high incidence of stroke problem, one, is to address the issue of non-communicable diseases and chronic diseases, which we will capture under the Ghana Medical Trust Fund. Now, once the complication happens, now it becomes more curative. And that is when we have to put in systems in terms of rehabilitation, and also perhaps other medications that can help with stroke treatment. But the best way is to prevent the stroke from happening in the first place. And that has to do with the primary health care. So we need to catch them at the primary health care level where they have the high blood pressure but have not developed the complications. Thank you.
Now, there is this disproportionate mortality ratio. It's clear there's a clear gender disparity, and that goes against men. What would you propose as a strategy to reduce this?
Thank you, Mr. Chair. TB is a communicable disease. So the solution to that would be to increase surveillance of TB and also to start early treatment before it also gets into a complication where there's gender disparities. Thank you.
Don't look at it.
Get into a complication where there's gender disparities. Thank you.
Don't look at it.
diseases. 43% of all mortalities in Ghana is due to non-communicable diseases. If we are able, and non-communicable diseases are more treatable, so that if you can catch a person with high blood pressure early and treat the high blood pressure, it will prevent a stroke. If you can catch the person with high cholesterol early and give them cholesterol medicine, it will prevent a stroke. So again, I truly believe that focusing on non-communicable diseases will avoid a lot of these complications while we continue to do the curative care with the communicable diseases, because that we have to increase surveillance to make sure that we catch those who have it so they don't communicate it to other people. Thank you.
I want us to spend some few minutes on the new health program and the issue of resource optimization. Do I repeat it for you? Very well. I'm saying I want us to spend some few moments on the new health programs and resource optimization. It's a notorious fact that we really have rising debt constraints in respect of our health sector. Now, you have introduced this health program alongside the existing NHIS. How can you assure the nation that this new healthcare policy is not going to compromise NHIS in view of the scarce resources we have?
Thank you, Mr. Chair. I believe that we just passed the bill, the health fund bill, the Ghana Health Fund bill, and in the House, I believe last week. So I truly believe that once I get to the ministry, I will liaise with my able health minister and see how best I can contribute or assist to make sure that the health fund bill has been implemented and implemented right. And I believe that once that has been implemented, we will be able to address some of the issues you have just mentioned. Thank you.
Share with us, the NHIS has gone through some reforms. What are the inefficiencies that these reforms cannot address that you hope to deal with under the new health policy?
Thank you, Mr. Chair. Again, I truly believe that there are two different entities. The Ghana Health Trust Fund, Mahama Cares, is not NHIS. NHIS takes care of our basic needs. It takes the formulary, which is the pharmaceutical formulary, is very limited. NHIS also has only a few, let's say, vendors that they deal with. Once the Mahama Cares kick in, it will be supplementary to the next level where NHIS cuts off, so that people with non-communicable diseases, people with cancer, people with end-stage kidney diseases, and our dialysis will be able to have the additional health care that they need. Thank you.
Very well. Let's go back into your area. Surgical capacity and emergency care systems. Records have it, like I've quoted Supra, with stroke leading mortality 73 per 100,000, road injuries ranking 7th, that is 26 per 100,000. How will your surgical expertise transform Ghana's emergency and surgical capacity beyond Accra and Kumasi, now that you are going in to support policy?
Thank you, Mr. Chair. Actually, I'm from the Western region, so I need to be able to influence that as well. So it will be definitely beyond Accra and Kumasi. We'll go to the Western region and the Eastern region and the rest of the country. In
You
terms
go
of
through Central region to Western, unless you always go by flight.
President John Dramani Mahama will take the Western line from Takoradi to Kumasi, so I don't have to go through Cape Coast. Thank you.
Hold on. So, Professor, let me understand the new policy. So, there's going to be a line from Takoradi to Kumasi.
That is correct.
Within these 4 years, correct?
That is correct.
So there will be another one from Accra to Kumasi, correct?
I don't know about Accra to Kumasi, but
How would you get to Kumasi and avoid Central region? Share with me.
You pass through Takwa and maybe very few parts of, but not through Efutu for sure.
So when you start from Accra, where do you move?
I'll start from Accra, I'll start from Takradi, and I'll go through Takwa, and I'll go through Insuta, and I'll go through Bekwai, and I will get to Kumasi without going through Efutu. Thank you.
Okay, so I mean, if you have to come to Accra,
If I have to come to Accra, I'll take a car from Kumasi and avoid Central Region, specifically Efutu.
well, this humorous moment is, at least it brings down any possible tension. That's good. A great sense of humor. So, Honorable Nominee, Efutu people are great people, you know.
My mom used to trade in Efutu with the ceramic in Winneba, so I've lived there before. Thank you.
Yes, and your aunties told me before you came in, before you took the oath, they told me that Grandpa, when he came for his missionary work in Esikado, there was no mission house in Methodist. So your ancestral home accommodated Grandpa. Your auntie told me.
He lived in my grandfather's,
I'm saying
my
they told me.
grandmother's house.
They've told me
Your
that.
uncle lived in my grandmother's house when
They've
he didn't
told
have
me.
any place to live.
They've told me. Now, let's look at some surgical intervention you established for stroke, emergency care, and neurosurgical capabilities in the regions. Are you looking at that? With your team coming from the US, now that you are part of policy, are you going to pursue this?
Thank you, Mr. Chair. I truly believe that stroke as part of non-communicable diseases and a complication of non-communicable diseases needs to be addressed. And once I get to the ministry, I'll work with my minister to see how best I can support that endeavor. Thank you.
As part of the new health policy, and I'm sure you were part of drafting the health policy of the NDC in respect of the manifesto, correct?
That is correct.
Right. So share with us, do you intend, as part of the new health policy, to develop trauma surgery capacity, particularly for road injuries, including training teams and establishing referral systems?
Thank you, Mr. Chair. I was really an advocate for the Winneba Trauma Center becoming a true trauma center, and that was one of the things I have discussed with my minister to make sure, because the Cape Coast Winneba Road is one of the worst roads in the country in terms of accidents and also mortality. So in between Cape Coast and Takrady, there probably has to be some sort of a trauma center in between. But now that you're grilling me, maybe I'll change my mind. I'm just joking.
I won't mind you. Now, let's deal with the issue of integrated disease surveillance and prevention. Our country faces dual disease burden. One infectious disease, I've talked about TB already, 48.6%, malaria 35, HIV 33.5 per 100,000, alongside non-communicable diseases, stroke 73, heart disease 37.7 per 100,000. Your training and John Hopkins creates integrated systems. How do you hope to use this by way of rolling out a similar system to deal with the aforementioned in our health sector?
Thank you, Mr. Chair. I truly believe that the health system needs to be readjusted to a certain extent in terms of communicable diseases. But that is why the NDC manifesto, we decided as a party to really come up with a manifesto that would address the free primary health care at the basic level, because once we're able to catch people at that level, we prevent complications. Then once the complication happens, that is when the Ghana Medical Trust Bill kicks in. So with those two policy directions, I truly believe that we'll address a lot of these problems that you have discussed. And I know that my minister is also very passionate about this topic. And so once I get to the ministry, I will assist him in any of the ideas I have and the examples I've had from living outside and working outside to assist him to address some of these problems. Thank you.
Honorable nominee, you would agree with me that there is definitely the need for integrated surveillance system to monitor TB epidemics and cardiovascular trends with its rapid response capabilities. Would you say that under the new health policy, this is being considered?
Thank you, Mr. Chair. That is precisely the question or the issue we wanted to address with the free primary health care. When people get health care at the primary level, which is at the CHIPS compound or the community level, we are able to do better surveillance at that level. Once at that level, when we recognize that the person is at high risk, we can remove that person from that level and send them to a higher level of care. So the solution to that problem will be a very comprehensive pre-primary health care, which my minister has already started working on. So I'll go, once given the nod by your committee, I'll go to the health ministry and assist my minister in implementing President John Dramani Mahama's visionary free primary health care policy. That is the solution and that is the game changer. Thank you.
Now, you would agree with me that to tackle the gender disparities in TB mortality, i.e. the male-female 60 versus 37 per 100,000, there would be the need to have a proactive community engagement and strategy. Would you say that this is also being considered as part of the new health policy of government?
Thank you, Mr. Chair. Again, the free primary health care policy is targeting the community. So that means that community education, that means that community outreaches, that implies community surveillance. Once we are able to identify high risk or medium risk people at the community level, we remove them and bring them to a higher level of care. Once they're in the higher level of care, that will be able to take care of them. Then the next level of the pre-primary health care policy would be at the CHIPS level, where people can go to a CHIPS compound and get a preventative and promotive primary health care. That will take care of most of the problems we are facing in Ghana in terms of the health system now. Ghanaians at that level are currently suffering. Ghanaians don't have proper access to health care. Ghanaians who are having potential high risk are dying at that level, which is what informed the decision by President John Dramani Mahama to come up with that free primary health care policy. It is the solution to our health problems at the basic level. Thank you.
Thank you very much. I think the leader drew our attention earlier on to the fact that I've said our questions should be short and the answers should also be short. Can I also draw his attention to what he also said earlier, that he doesn't want our moms and dads sitting behind the nominee to sit here for a long time. We have been here for over 3 hours. So can I just avert the leader's mind to what he said earlier on, as which we all agree. So have that in mind, leader.
Thank you, Chairman. Honorable nominee, please, the earlier document that I gave, look at page 3, the one that brought a bit of disagreement on Bishop Porter girls. Yeah. At page 3, the paragraph 11, the last sentence, can you read it aloud? He described, that's what they say. He described the subject on your.
He described the subject as knowledgeable, meticulous, selfless, and dedicated.
That is from Professor Kweku Danso Boafo, your referee. You agree to that, with that, correct?
That is correct.
Now, you were handed a one-page document coming from Alliance for Feminists, CSOs. Have you come across this document, please?
I'm seeing it in front of me now.
Very well. Please have a read of the content quietly and just share with me whether you agree with the content of what has been put out there, respectfully.
Thank you, Mr. Chair. I have read that it is a press statement from an alliance of feminist CSOs. And I'm neither here nor there, but I do believe that they must have seen something, said something, and written something. Thank you.
I didn't get the last part. You said you believe that they might have what?
I believe that the Feminine Alliance CSO may have seen what happened in the first document you gave me, that speaker spoke, and then they made a statement about it. Thank you.
No, but this document is dated July 16th. July 16th.
That is correct, but the document is not coming from me. It's coming from the Alliance of Feminist CSOs.
Yes, because
so
you added, very well, because you added that they did so in response to speakers. That is why I'm drawing your attention of the date on that document.
Then perhaps they did so in response to what they saw on TV, which is the parliamentary TV that is open to all Ghanaians.
Very well. So what I'm asking you is that if somebody sees something on TV and forms an opinion, and that opinion, as they've expressed, it's a general advocacy in your favor, I'm asking you, do you agree with them, or do you agree to the content as they put out. That's all.
Again, I believe that I didn't write the document, but I believe that they must have seen something. They must have felt the way they felt, and they must have written the document. If the document favors me, well, I think it's not bad that the document favors me. But I can also speak to the document because I'm not familiar with who actually wrote it. Thank you.
Now, if you say, if the document favors you, we're not dealing with hypothetical situation here. We are dealing with real life situation where in our local parlance, they say, quote, obi enum edruma oyerefo. And I remember my grandmother always saying this to me, Infante, that mewu obi nkama obi. Mewu obi nkama obi. So he who feels it knows it. I want to know from you, beyond saying that if it favors you, why not? Do you yourself feel the feeling they are describing? That is all I want to know.
Thank you, Mr. Chair. The Alliance of Feminist CSOs probably saw what happened on TV, which is a public document now, and they had an opinion about it. Oftentimes, women are treated this way in the workplace. Oftentimes, women are denigrated. Oftentimes, women are called names. Oftentimes, a woman who's assertive and a woman who knows her worth is called disrespectful. And oftentimes, a woman who has an opinion is called rude. So I think that the document they wrote was in favor of all women, and I believe that every woman that reads that document will have some sort of identification with the document. Thank you.
My dear colleague, you know, I'm spending a bit of time on this because, first of all, we all identify, you and I identify ourselves as Christians. And the basic rule is for us to be sincere with the facts. Let's not be hypothetical. We are not in a courtroom, and we are not in a win or lose situation. A document has been altered, and the document makes direct reference to you. I want to know from you, specifically, those allegations contained in the document by way of their advocacy in your favor, based on, according to you, what they've watched on public TV. Because in our parliament, there may be things that we may be saying or doing that somebody may misconstrue. So that is why, Chairman, please, let me finish. Let me finish. Just a second, just a second.
Minority Leader, please go ahead. Thank you.
Honorable nominee, this is very important to me. And I will want us to depart from the arena of hypothesis and deal with the real situation and be very honest with ourselves as far as practical. Would you say that this advocacy in your favor, you relate to it directly? It's as simple as that.
Thank you, Mr. Chair. Again, I am not being hypothetical. Every woman in this room can identify with what they have put down. Every woman in a workplace has gone through some sort of workplace harassment. Every woman can identify with this document. So a CSO saying something on my behalf and a lot of those things which I can identify with, I don't think there's anything wrong, and I truly don't think it's hypothetical. Thank you.
Honorable nominee, so, it's a good point for me to now land with a specific statement to you. Though you say it is somebody saying it, but have it on public record. If our usual playful rhetoric on the House floor, which is usually the practice in days where we are all relaxed in the chamber, affected you, or that it made you feel bad or harassed, I say to you, I'm sorry. If that is what it is, because I wanted you to get there, but now that you say you feel harassed, because this content of a statement by a CSO, where you and I know on the floor, sometimes you come and sit in front and do some heckling and we playfully get at each other. And somebody outside may not know. However, as we all know, if you have a feeling that that particular act by me as a leader, and I'm not a backbencher, I'm a leader. Therefore, if a playful moment in the chamber affected you, you felt harassed at the workplace, you felt emotionally disconnected, you felt that somebody was going at you, I say to you, I'm sorry. And it will never happen again.
Thank you. Technically, though, when you apologize, you don't have to qualify it with an if. Thank you.
So I would take the if from there, maybe for want of a better grammar. I want to say to you that to the extent that as a colleague, we play, we relate, you and I, we relate, very formal, informal. And at that moment, unbeknown to me, you felt that, no, I had crossed the red line. I say to you, I'm sorry. Is that fair?
That is fair, and I'm very appreciative that you have taken this opportunity to apologize. And I hope that moving forward, we'll have a better relationship. And I'm very grateful and humbled. Thank you.
But I thought that even after that day, the next day you had come to me and we had a hearty chat. After that, we met in that small room with other colleagues and we had a hearty chat. But if this helps for a better relationship, why not? I accept it.
Thank you, Mr. Chair. Once you apologize, you don't have to keep going. Thank you.
I needed to clarify the point. We are on national TV, and I want to be sensitive to your feelings because I am a husband and a father, and I wouldn't want anybody to do that to my wife or my sister. So once you feel that way and you have expressed it, or somebody has expressed it on your behalf without you saying it, it's my duty to react to it as a Christian who wants to perfect my Christian life. So I'm sorry once again.
Thank you. As a wife and a mother and also a Christian, your apology has been accepted. Thank you.
All right. So let's make progress on... You want to say something?
Leader, from the last statement you have made, I have a feeling that you are beginning to land.
Honorable nominee, many people get inspired to get into politics. From the records you provided us, you left the US, came to Ghana to contest elections. You've done social services, humanitarian work. When was your first public elections that you contested?
My first public election was in 2020.
Now, may I know from you, within the period that you stayed in the United States, did you ever acquire citizenship?
That is correct. I was a citizen of the United States for several years.
At what point did you give it up?
I renounced my citizenship on June 20th, 2020. Thank you.
So currently, are you on a green card status, or you have to apply for visa when going to the United States?
Thank you. I have renounced my U.S. citizenship over 4 years ago, and I travel on a U.S. visa. Thank you.
Now that the American government has this policy of 3 months visa, considering how public service may cause a lot of travels, would you advocate for a review of that policy?
Thank you, Mr. Chair. I'm not even currently familiar with that policy, so I need to go and review that policy, and then I can have more informed answers to it. Thank you.
Honorable nominee, you've shared with us your business interests in Ghana. May I know from you, do you still have businesses registered? I mean, profit-making businesses. In other words, a company limited by liability in the United States.
Thank you, Mr. Chair. No, I do not. I do have properties there, though, so thank you.
You do not also have investment in any company in the United States?
I do have personal investments, which I've declared, and I do have properties in the U.S. I worked for almost 30 years in the United States. So I did acquire some properties, and I also had some investments. Thank you.
Okay, please. You said which you've declared. Is it in your CV, please? Have you stated them in your CV?
What's that thing called?
Honorable nominee, you on oath. Clerk to committee, you know the rules.
I have declared it on my assets declaration. Is
if
what I'm
there's
trying
any
to say.
you've been communicating. I've just ignored that, but on this occasion, I'm drawing your attention that if the nominee wants some information, the chair is here. I'm very careful and very particular, about how I deal with issues. So please, don't cross the line. Yes, honorable nominee, you said you've declared.
Yes, I've declared it on my assets declaration form.
Oh, I see. When did you file your asset declaration?
I believe I filed my asset. I have the receipt. I believe it was sometime in March.
Very well. So, would you be surprised if a document is produced that suggests that Professor Grace Ayensu Dankwa has shares in not less than 3 limited liability companies in the United States? You'll be surprised.
I will be very surprised. I did have a private practice, that I registered in California, but I gave that up a long time ago, so.
Now let's come to your taxes. Did you at any point have to go to court? Let me put it properly in an ordinary man's language. Did the tax authorities in the US at any point whilst you were there pursue your tax liabilities in court where you were fined? Was there anything ever like that on your records?
Thank you, Mr. Chair. I have never been to court for any tax liability in the United States of America. Thank you.
Do you have any tax liabilities in the United States now?
I renounced my citizenship in 2020, and prior to that, I have no tax liability that I know of.
But you still have properties there.
That is correct, and all the property pays the property taxes. So there's no, they are all with like a asset management company. So they manage my assets and pay whatever taxes they're supposed to pay on it.
Now, as a non-resident in the United States, have you become aware that you not being a resident in the United States, you cannot own a property there? Or you've been advised that you can still own property
At the time,
whilst you
at the
you
time
go
I
there as a
bought my
visitor?
properties, there was no rule that you cannot own. I know people come from all over the country, all over other countries to buy properties in America. I'm not familiar with what you're discussing. Thank you.
Would you be surprised if any document is produced that suggests that you have some tax liabilities in the United States?
I have no tax liability that I know of. Like I said, my properties are with an asset management company, and I don't do anything with it. So if there's any liability, it will have to be the tax company. But personally, I don't know anything that I have any tax liability. I renounced my citizenship in 2020. And up to that point, I believe that I had paid all my taxes. And after 2020, I don't have any American tax liability. Thank you.
Now, in your constituency, yeah. Oh, sure.
Just a point of correction. You don't have to be a citizen in the United States to own a property in the United States. So I think that has to be corrected. Leader, I'm sure you are with me. Yes. That you don't have to be a citizen of the United States to own a property in the United States.
I think she's answered it. She's explained it.
Well, for the record, we put in.
No, but her answer is a matter of public record. So
well,
don't
her answer was not clear to me. That's why I have.
Very well. That's fine. We are here to clarify. Honorable nominee, so people get their inspirations from individuals who are already in politics, and that's get them into politics. You have pursued your political dreams in the NDC. A friend of mine said he was largely inspired by the respected Ahoy brothers. Another friend of mine told me he was inspired by the respected veteran Kofi Totobi Kwache. Tell me who inspired you to come into mainstream politics in the NDC.
Thank you. I was inspired by John Evans Atta Mills, ex-president of Ghana. He was the reason I entered politics. Thank you.
Great. Now, your constituency, now that you have the mandate, first, what were the developmental gaps that you identified upon which you mounted your vision?
Thank you, Mr. Chair. I mounted my vision to enter politics not just on developmental gaps. I also mounted on human development. I felt like a lot of the youth, and especially the kids, have not been given the opportunity to live up to their best, and those are one of the reasons why my candidacy or my MPship is actually pegged to how well I can situate the youth and especially the children within my constituency in terms of human development and human capacity building. Thank you.
Honorable nominee, what should your constituent expect now that you are their MP and also that the party you support is in power?
Thank you, Mr. Chair. My constituents should expect a different kind of politics, a politics that is devoid of extremism, a politics that is available to the people, a politics that is of humility, a politics that is of human interest, a politics that is of the development of the community and the constituencies, a politics that hopefully in the next 4 years I will be able to leave a legacy. Thank you.
In terms of infrastructure, what should they expect?
In terms of infrastructure, I would expect that I will make sure that I bridge some of the gaps. The District Assembly Common Fund will be used to the best of my abilities. I promise my constituent that if I'm given any public funds, I will use the public funds for public good, and I would not appropriate any public funds to myself. And where I need to add, I will go and find the money and solicit and advocate and add to improve the standard of living and the conditions of my constituents. Thank you.
That mall that you built in the constituency, what did you do there?
Thank you, Mr. Chair. The mall was one of the biggest refuse dump in the constituency. Thankfully and luckily, I'm from the royal family. My Omahin, who is also my brother, my older brother, is behind me. So they gracefully offered me the land, and I was able to take the biggest refuse dump in the community and turn it into a multi-purpose mall. In the mall, I have my constituency office. I am doing, because it's only 2 minutes from the hospital, we are doing ultrasound, which is a scan. We also have a pharmacy. I have a food bank which gives free food to people. It's not going to be cooked. It's just going to be, it is like dry foods like rice and gari and stuff like that. In the mall, I also have an event center, and I also have a guest houses, which I have named after my grandmothers. Thank you.
So you are planning to hold the constituency perpetually, correct? Anyway, that's not a question. Now, that's not a question. Don't be in a hurry to answer.
Before you go on, please.
Oh, okay.
We said earlier on that for our own health and the health of our visitors that we have here, we will try to close at a decent time. As a chairman, I would like to close this meeting within the next 5 minutes. And so I want a leader to basically wind up and land. So latest by 10 o'clock, this meeting will be closed at 9 o'clock. Because, no, what I want to say is that we've been here for 10 hours. So 9 o'clock, this meeting will come to an end. We'll draw the curtains to a close. Thank you, leader.
Thank you, Chairman, for your kind courtesies and indulging me. May I know from you, Honorable Nominee, this mall that you've described, how was it funded? Is it owned by you?
Thank you, Mr. Chair. The mall is 100% owned by me, and it was 150% self-funded.
That's commendable. Chairman, that will be all
Mr.
for
Chair,
her.
I have worked very hard in my life. I have been very hardworking to afford it. Thank you.
Nominee?
Let me finish.
Yeah, okay.
Chairman, I recognize the Paramount Chief of Esikado. I greet you well. Honorable nominee, I wish you well.
Thank you, Mr. Chair.
Thank you. Thank you very much. Now, as I said, I'm bringing the curtains to a close. Before I do that, I want to recognize the guest who came here to support our honorable sister. I will also first recognize Nana Kobna Nkatia Otodenum, the fifth, Omahino of Iskadu traditional area. Nana Kwamina Ahin Kofi, the fourth. Nana of Ahin Kofi Krom, secondary traditional area. Nana Kodu the second, Obahima Isikadu traditional area. Nana Efwa Yiba the second, Obahima of Interkofo. Sorry about that. Nana Ekua Mansa the third, Omahin of Kasawedu. Council. Nana Ama, the Nsia of Akwabia Hima. Ebusia Pain, Kwesi Akon. Ebusia Pain, Eskadi traditional area. Nana Toku, chairman of Western Region NDC. Mr. Charles Fojo, Western Region organizer of the NDC. Nana Debord Hill. Mr. John Mensah, former chairman, Esikado Katen. Alaji Ibrisu, Council of Elders, Esikado Katen again. Margaret Anse, CEO. Sophia Ama Otabel, Western Region, Pro Forum. Marcia Ashon, niece. Mrs. Hectoria Odum, sister. Agatha Annan, also a sister. Very Reverend Kofi Oche, Methodist Church, Iskado. Mr. Mauli Deke, brother. Haruna Salifu Azika, chairman, Shama constituency. Last and not the least, Michael Otu. And we also have presence here, the minister for, go to so many ministers, I can't remember. Ama Elembele, Ama Kofi Boa, the long-term minister, still a minister. Oh, he was actually supposed to be here this morning to cover or to support Honorable Dorcas Tofe, but he had an official function and was not able to be here. And all the other nominees. Thank you very much. Deputy Minister Designate, you will hear from the committee. I would like on this occasion to discharge you You are discharged. Thank you very much.
Thank you, Mr. Chair. I'm grateful.